Hi everybody, Dr. Britt Talley Daniel MD. I'm a neurologist, headache doctor, a blogger with about 130 articles on my webpage, which is www.drmigraine.com. And I've written 2 textbooks on migraine. I have a bunch of YouTube videos on migraine. I'd be very appreciative if you would be able to check the subscribe so you can follow my talks here today, because I'm going to give more YouTube videos as time goes by. Today the title of the subject is, are triptans safe to take while breastfeeding? Good question. Now, triptans, we're talking about 7 drugs that are given orally. 2 of them have nasal sprays and 1 of them has a shot, and that's sumatriptan. Sumatriptan was the first drug that came out as Imitrex injectable, 6 milligrams subcutaneously, like in the arm or the buttock area. Came out about 1990. And the FDA had a statement then, and they've never changed, which is still their opinion, which you shouldn't use triptans during pregnancy or during breastfeeding. Triptans are the best drug for acute therapy for treating migraine at this time, and something like 70 to 80% of patients who take a triptan at onset of migraine will be headache-free in 2 hours. Now, there's a non-response rate in 20 to 30% of patients, and some people will get a side effect from the drug. Most times they're mild and nothing serious. For instance, a common triptan side effect would be tightness in the neck, which comes when the smooth muscle of the neck constricts from the effect of the drug like sumatriptan. During migraine, there's a signal given to dilate the arteries in your brain, and so triptans cause constriction of the arteries. So triptans will help the headache but cause your esophagus to constrict a little bit, and it makes you feel tight. So it's not a serious side effect. Usually if that's explained to a patient, they can go ahead and take it. Or 60% of the time if the doctor switches to a different triptan, because there's 6 other triptans besides sumatriptan, or he drops the dose from like 100 milligrams to 50 milligrams sumatriptan, the side effect will go away. Alright, so are triptans safe to take during breastfeeding? Well, the answer to that is yes. Triptans are safe to take while breastfeeding. Nursing infant absorption medication for the mother's milk is so low it's not enough to harm the baby. That's what's been found. And so there are many recent medical studies supporting the safety of triptans during pregnancy. Now, one of these non-absorption studies was a Canadian family physician article in 2010 where they really investigated 5 nursing women who had received subcutaneous sumatriptan. And they checked the dose in the milk and in plasma in the baby and the mother. And they found that infants received 3.5% of the maternal dose. Well, as a rule, it's been stated regarding medications for babies that if it has an infant dose less than 10%, and this triptan was 3.5%, then it's compatible with breastfeeding. So that's been studies that have been done and helpful. Well, what's the position of the American Academy of Pediatrics on that? They have considered sumatriptan as usually compatible with breastfeeding. There's been another study using another triptan, Imitrex, 80 milligram dose, which didn't show any problem with the baby. It was okay. It had a very low dose in the baby. So triptans are now generally considered to be safe to take during pregnancy. That's good, because triptans are the best drugs for treating migraine. Another question would be, women that breastfeed, is there a decreased risk of migraine in them? Yes. One study showed that 100% of women who bottle fed their babies had their migraines return within 1 month, while only 43% of those breastfed did. So that shows a perhaps protective effect from breastfeeding, but not all studies have shown that. Does migraine get better during pregnancy? Well, 50 to 75% of women have fewer and less intensive migraine during pregnancy, which is a high estrogen level, and some women get headaches when estrogen is cycled, like with this comes every 3 to 4 weeks. They'll have a cycle, and then the estrogen levels drop, and they get a headache during that time. So pregnancy is a high estrogen level, and women mostly do well during that time. But what happens during the postpartum with these ladies? 34% of all women have migraine headaches occur after their baby is born. Migraine is a genetic problem. You're born with it. You're going to have it all your life. Usually gets better as you get older. So within the first week after delivery, migraine sometime will get better during that time. There's an importance of breastfeeding, of course, and everyone knows this. For babies, breastfeeding is important health and emotional benefits. The mother and the infant should be encouraged. The mother bonds with her child, provides important immune therapy through her breast milk. Breastfeeding stabilizes estrogen levels, which can plummet to zero if you don't breastfeed, and that aggravates migraine. Breastfeeding is recommended by the American OBG Society and also American Academy of Pediatrics. I want to give a site. I've got this on a blog article on this. You can see the same subject on a blog article at Dr. Migraine. So are there references for lactating mothers that gives helpful information regarding medications? So you can go read about this at the American Academy of Pediatrics publication is called The Transfer of Drugs and Other Chemicals into Human Milk. Thomas Hale has a manual called Medications and Mother's Milk. Briggs, Freeman, and Yaffe, spelled Y-A-F-F-E, have a reference book called Drugs in Pregnancy and Lactation. And the National Library of Medicine has a book called The Drugs and Lactation Database. What else could you use for treating pregnancy while breastfeeding? Well, a simple thing there. First, you can just use quietness, lying down, neck massage, ice on the head, restrict use of the eyes, close the eyes, don't watch TV or get in the sun. Many patients are okayed by their doctors, pediatrician, that will be, you can use Tylenol first, which a lot of folks will take. That seems to work okay. Ice bags over the head will help a little bit, but still, if the headache gets bad, it's not worthwhile to have a woman who's going to be vomiting, getting dehydrated in bed for a day or two with a migraine. It's better just to go ahead and treat them. And women should always, as all migraine patients, should do the migraine lifestyle, which is exercise, set in their sleep pattern, no caffeine, 3 meals a day, set in their sleep pattern, getting up and going to bed, aerobic exercise, and those kind of reasonable things. Are the new CGRP inhibitor drugs like Jovi or Emgality approved for migraine or for treating migraine, preventing migraine during pregnancy or breastfeeding? No, the FDA has not released those here. All right, well, this concludes my talk. Hope you're doing well, all you mothers who have migraine and breastfeeding. God bless you all. I'll see you again on another talk. Bye-bye.